And we begin this evening with a live look in Quebec. We're waiting to hear from Premier François Legault this moment. Let's take a listen.
Hi, everyone. As you've seen over the past few days, Quebec is being hit very hard by the Omicron variant, like many other places in the world. And for the past week, we've gone from 2,700 cases to 6,300 cases yesterday. And today, we should have approximately 9,000 cases. So there's truly a steep exponential increase in cases. And we believe, the specialists believe, that this will have an impact on hospitalizations. Already, since the past week, we've gone from 309 hospitalizations to 445. And so we believe that in the next few days, there will be a big increase in hospitalizations. That is what is our most important objective since the beginning. What we want is to not have the hospitals be overwhelmed so that we can continue to treat everybody, whether it's COVID patients or regular patients. And that is why we have new measures today. First, we are asking everybody that as of this Sunday, the 26th of December, to limit the number of people in private homes to 6 or 2 bubbles, 2 family bubbles. And we're asking the same thing of restaurants, and that is that for each table in a restaurant as of Sunday, it'll be a maximum of 6 people or 2 family bubbles. This means that by Saturday, we are letting people who absolutely want to meet and gather in a group of 10 to do so. However, I invite all Quebecers who are able to postpone these celebrations to do so. And also, once again, we're asking to have only one celebration, either the 24th or the 25th of December, for example, but not both nights. But the most important thing, it's important that everybody understand this. The most important thing is people 60 and over. We have to look at the numbers, and we see immediately that 70% of hospitalized people with COVID are 60 and up, 70% of these people. So that means that it's truly these people who are at risk of being hospitalized, and mainly people who haven't had their 3rd dose yet. With the Omicron variant, they're truly at risk. So ideally, of course, for people who are 60 and over, perhaps I'll ask to remove this from the front. I could see all sorts of text, and it was confusing me. So I'm sorry. So I'm coming back to people 60 and over. The most important thing is truly people who are 60 and over, who they're the most vulnerable. And this is a question of judgment. Ideally, of course, you stay home. I'm reminding you, the virus can be caught just when we're in contact with other people. So if you stay home, there is no risk. If you must absolutely go to a family gathering or a friendly gathering, well, you must know that there is a risk, first and foremost. And if you are ready to take on that risk, well, there are 4 ways of minimizing this risk. First of all, of course, reduce the number of people. Second, wear a mask. Third, keep a distance of 2 meters with other people. And fourth, on a regular basis, open at least 1 window in the house to ventilate the space. So if you truly must gather with others, people who are 60 and over, but I'm repeating myself here, that's where we've got 70% of our hospitalizations. Of course, this doesn't mean that there are no risks with people who are under 60. There's still 30% of our hospitalizations that are among these people. So those people as well must make some efforts. And when I ask to make efforts, it's mainly for the healthcare workers. It's been 22 months that our health workers have been on the front lines. And of course, a lot of people are exhausted, and they can also get COVID. It's important to say, we were talking about healthcare workers who got the virus. Most of them got it either from their children or their friends, like all Quebecers. So we must be very prudent. Everybody must do their part so that we are able to continue to treat everybody. That is why we have made some difficult decisions over the past 22 months. I'll remind you, Quebec has always been one of the places in the world, and certainly in North America, where we've got the most strict measures. And of course, we do this first and foremost for the healthcare workers who have been heavily taxed over the past 22 months. The other thing that's important as well, and it may seem obvious, but as soon as you have any symptoms, it's important to stay home and to self-isolate. Now for the tests. Dr. Arruda, I will hand the floor to him afterwards. We have to understand that as soon as we get quick tests, right, for home from the federal government, we deliver them to drugstores. Of course, we don't have enough quick tests for everybody right now, and that is why we have said for the time being, it's important that these tests be reserved to people who have symptoms. And it's important as well that people who are waiting in line to get a real test, what we call the PCR test, well, this also has to be for people who have symptoms. And of course, you'll understand that by going from 3,000 cases to 9,000 cases, well, of course, there's a lot more people. And yesterday, we had 50,000 tests. We're at record levels. But like everywhere else, the number of people to screen is limited. We also want to accelerate vaccination. And the quick tests, eventually, I was hearing the Prime Minister of Canada who said today that he'll send us more. And as soon as we get them, we will send them to the drugstores. And eventually, it can be a precaution that we use. But for the time being, it's important that whether it's a quick test or the PCR test, that we keep those for people who have symptoms. What's also important, and I know once again that there are people who got 1 dose and 2 doses, and now they're a bit fed up and they say, do I really need to get the 3rd dose? Yes. There's really a big difference in the risk between people who have 2 doses and those who have the 3 doses. So we must go get the 3rd dose. Currently, people 65 and up can get their 3rd dose immediately. People 60 to 64 years of age will be able to make their appointments as of Monday, the 27th of December. So please go. It's important. Earlier, I was talking about vaccination. As soon as we got the okay from public health to increase the pace or to reduce the interval between the 2nd dose and the 3rd dose from 6 months to 3 months, well, we accelerated our vaccination. I want to thank all of those who have registered in Je Contribue, all the doctors who are helping us out. We have managed to go from 40,000 vaccines a day to 88,000 vaccines per day yesterday. So things are going well. And we believe that, of course, as we give the 3rd dose, that this will help to keep control in our hospitals. And it's important to say this. The measures that we're announcing this evening, we believe that it's enough to keep control of the hospitals. But we will not hesitate in the next few days, if it is necessary, to add other measures So it's important for everybody to understand this. Now, I have a message for people who are unvaccinated. First, regardless of what you are reading or listening to, it is clear that you are at much greater risk because you're unvaccinated, and you are putting at risk our hospitals. And I'll just give you two numbers. Right now, for adults, we've got fewer than 10% of adults who are not vaccinated, but they represent 50% of hospitalized persons. That means that if we didn't have the unvaccinated, who don't even represent 10% in Quebec, we would reduce by half our hospitalizations. So it's very serious, and regardless of the reason why you don't want to be vaccinated, I am asking you, if you don't do it for yourself, do it for others, but stay home, because there's a risk, a greater risk, that you will end up in the hospital and that you will overwhelm our hospitals and perhaps stop some people from getting urgent care. And of course, we will talk about postponement. So unvaccinated people, I'm asking you, for Quebec, for others, stay home, please, if you don't want to be vaccinated. A word for all of those who have worked for the past 22 months and who will be working during the holidays in the health network. Of course, we will never thank you enough. I know that it's been difficult, but all of Quebec is counting on you. We need you. The next few weeks will be critical, and it's important to have all of the staff that we can have, whether it's doctors, nurses, all the healthcare workers. It's important so that we can get through this. So we are asking you to make more efforts, and I know that we have asked you for a lot already. In closing, I want to tell Quebecers, over the next few weeks, we will go through a very difficult period, but it's not the first time that our people face a big challenge. And we've always succeeded in having solidarity and social cohesion among us. And I'm confident that because of this, that we will be able as a people to get through this big challenge. But over the next few days, we will need each other. It's not going to be a beautiful Christmas for everybody, so it's important to help others. Call people who are alone and take care of each other. I'm counting on you. Thank you very much. And on this, I will hand it over to Dr. Arruda, who will talk about screening tests. Thank you, Mr. Premier, Mr. Minister. I wanted to take a moment to come back and talk about testing and the use of quick tests at home. I want to tell you that tomorrow there's going to be a technical briefing. Journalists will be invited so that they can ask all of their questions on the different situations. There's all sorts of graphics that will be made available for the population so that they know exactly what to do. You know, right now, we pretty much all know somebody who's had COVID-19. So the cases are increasing exponentially over the past few days, and that has brought us to review our strategy, our screening strategy. The screening capacity in Quebec has evolved quite a bit. We'll remember that in September 2020, we had approximately 15,000 tests a day. Right now, our capacity is at approximately 50,000 tests a day. But right now, with the quantity of cases that there are, we must have a certain approach that will allow to use as effectively as possible these tests. We're at full capacity already, as I said, and given the context, the lab test should be reserved to people, as the Premier said, who have symptoms that look like COVID-19 symptoms. That's fever, coughing, sore throat, loss of taste or smell. So from now on, we really have to go to the screening centers if you are in one of the following categories. If you have symptoms and that you don't have a quick test at home, you make an appointment, you isolate, and you make an appointment to be tested. If you have symptoms and that you do a quick test at home and that the result is positive, you isolate, and you can go do a test in a screening center to confirm if it's accessible for you. But you can rely on the quick test and stay home so that you don't transmit the illness to somebody else. If you were in contact with somebody who has COVID-19, we are asking you to isolate for 10 days and to go to a screening center only if you develop symptoms, COVID-19 symptoms. So you keep an eye on symptoms first and foremost, and if you have symptoms, then you go to a screening clinic. And once again, it's strongly recommended that you take an appointment so as to limit the risk of transmission to others and also to avoid to wait in line, because with an appointment, we'll be more fluid. Now, this new approach will allow us to prioritize people who are the most, who most probably have a COVID-19, and to accelerate the process for everyone. And from now on, the results, the test results, the positive test results, will be communicated to you by email for those who ask for it. People who are infected will have a confirmation quicker, and they'll be able to then inform quicker their close contacts. And you'll understand that with more than 9,000 cases, the public health teams can no longer trace back all of the cases and contacts. So we're asking you, if you were symptomatic and you have a positive test, we're asking you to collaborate to advise the people with whom you were in contact since your symptoms appeared. And quickly, I insist on the fact that it's preferable to use the quick tests properly, either for people who have symptoms. It's not useful right now to waste a test just to see if they're working well. I would also like to talk to you about the importance, one of the most important things, which is vaccination and the famous booster shot. We have to understand that we're accelerating the vaccination campaign over the next few weeks. We saw over the past few days a significant acceleration, and people will be offered the vaccine, the Pfizer or Moderna vaccine, depending on what we get. I'll remind you that these are 2 mRNA vaccines. They function similarly. They are considered as interchangeable. Getting a different vaccine from the one that we got for the first or the second dose is safe. So perhaps you got a Pfizer, and then we'll give you a Moderna. It's absolutely okay. The Pfizer deliveries will be limited over the next few weeks, but if we offer you a Moderna vaccine, please do not hesitate to take it. The booster dose will protect you because the virus is circulating quite a bit, and we'll do all that we can to accelerate access to appointments. In closing, I'd like to call upon your civil sense. Over the past few days, some incidents happened in testing centers or in vaccination centers and in the pharmacies and the drugstores. We understand that people are stressed and worried, but we must remain civilized. We understand that the situation can be stressful for many people, but the staff is there to help us, and we must treat them respectfully. And finally, one last comment, if you'll allow me. I think that you're seeing to what extent the virus is being transmitted right now. I think that the more we come out of our bubble, the more we expose ourselves to risk. So if you can decrease your contacts, even during the holidays, I invite you, I strongly urge you to limit your contacts.